good to see you there, Sarah. She's with the Office of Homelessness Assistance and Poverty Prevention, OHAP, and she's the director. So good morning, Sarah.
Buenas, Denhoff Day, you too. Very glad to be back on KOAM. I hope everyone's well and staying safe and healthy, right? That's what we got to do every day.
Yep.
That's right, every single day. You know, we've been wanting you to come on to just give us an update on some of the things you guys have been doing over there at OHAP.
Yes. So I'm glad to be here and just, take a few minutes to give you and our community an update on what's going on. We're the Office of Homelessness Assistance and Poverty Prevention. And I'm just so glad to report to everyone that we're getting staff on board. We have a social worker, we have 2 community outreach folks, and we have an admin person. So we're still looking for another social worker and a clinician to join us to do on the ground evaluations, because as we go about doing our outreaches, which we have been doing, it's incredible some of the presenting challenges our people have that live out in the streets, live unsheltered. We have identified quite a number who appear to have, issues with behavioral health issues and challenges that are perhaps untreated and not addressed. And of course, the most, I think, heart-wrenching problem that we continue to see is meeting people that have disconnected with their families. They have families here, but for whatever reasons, for many reasons, and I'm not going to say they're not good reasons, but for many reasons, they have disconnected from their families. And as a result of that, they are living in just some very interesting places that are really not meant for people to live in, and a lot of them are tents or just out in the open air without really the cover that they need. And of course, we're concerned about that. Like some people will say, hey, it's their right to live on the beach, live in the boonies, and it's true, that is everyone's individual right to self-determination, as said in our field of human services, that everyone has a right to self-determination. In other words, they can determine where and how they live. However, when it poses a threat to their health and safety and to other people, that's when it becomes the concern for us. And as you have heard from the governor and lieutenant governor in this last year and a half, the concern about the health of our people and the safety, it's like they have a greater likelihood of getting exposed to COVID, other communicable diseases, including tuberculosis and HIV, and just being sick. And that's what we don't want, is to the point where people are so sick that, we're not able to help them. And we unfortunately have lost too many people to COVID. And we have people that are suffering from untreated communicable and non-communicable diseases. Mm-hmm. So that's the health perspective, the safety perspective is paramount, and it's very concerning. And so although we have a great respect for people to choose where and how they live, we also need to make sure that we're doing everything we can to educate and protect our people as best possible. So that's where we're at. We're doing quite a bit of outreach, connecting, and we spend a lot of time sitting and talking with persons who are homeless. I think that's really the key to developing a strategy for a community, is really listening to them, understanding what their challenges are, why they choose to be homeless, and why they are not on the path for permanent housing. because that's the goal, is we want people to be in a safe home environment, and make sure that it's something that they can sustain in some place that will be safe for them.
Right.
So trying to understand this, and even though we've had many years of experience working with this population, we always need to listen and understand, what these issues are that they're facing, so that we can get them the support that they need. And
Mm-hmm.
I think what we're finding out is that sometimes our services can only be accessed, for example, in the offices. People have to make appointments, come to their office. Some people don't have transportation. Some people don't know where these offices are. So bringing people out to the people, bringing the services out, is where we're trying to get. It's like, at least for those initial, the initial contact, developing rapport and trust with this population, so that they will come in and they will seek services. So that's where we're at right now. But
Mm-hmm.
I'll tell you, it's heartbreaking. It's difficult, even for someone like me who's been in the field for decades. Hearing and seeing our people who are out there in those conditions, and who don't see any hope for coming in and getting permanent housing. But we're working on it, and prayerfully in the next couple of weeks we'll be fully staffed, and we will also, the partnership is awesome. I'll tell you, Guam Behavioral Health, Public Health, DISID, and a couple of other agencies, government non-profits, have formed a multidisciplinary team. We meet every week, and part of that is to develop those strategies for intervention, for support. How do we reach them? What is it that we can do? Who are the best players to go out and establish rapport? Because sometimes the best players might not be us to establish that rapport.
Mm-hmm.
So we're meeting every week, and we're moving. I'm feeling much more hopeful than I did a couple of weeks ago. And I really appreciate the fact that the homeless population is opening up to us and sharing with us what's going on with them. And I can't tell you how valuable that is, to have them trust us to tell us what's going on. So that's where we're basically at right now. You guys have any
Yeah,
questions? Yeah.
we certainly do appreciate all the hard work that you're doing, and the office and your social workers. But I did want to follow up on the situation over at the global dorms, and what exactly is going to happen to the global dorms once we're out of this public health emergency. We had Ray Tapasya on earlier this week, and he's also with your group, and he was saying that no, it's going to remain open. Is that in fact the case? It's going to be a permanent homeless shelter.
Okay, well, I'm glad that you got to talk to Ray Tapasyan over there. In fact, I have a meeting with him later on this morning to talk further about some of the strategies to get people into permanent housing. That's the goal. As you know, Guam has received some vouchers for
Yes.
permanent housing, and those vouchers, they're being vetted now, and if the people at Global are eligible or not for them has not been, I'm sure there'll be some, but I can't say that there's 50 some people that are up there right now. If any or all of them will be eligible, that's where GURA comes in. They have to make those decisions based on the regulations and the eligibility requirements. So that's going to be in their court. But in the meantime, I will tell you that nobody's going to get thrown out in the streets because we're in PCOR 4. What we're going to do is find as much as or as quickly as possible ways to fast track them, which is part of the multidisciplinary team's goal, is to identify what is it that needs to be done so that they get into safe permanent housing as soon as possible. So we're working on that, and hopefully in another week or two, we're going to see people exiting that are going into permanent housing. That's
Mm-hmm.
what we would like to see in the next couple of weeks. Is
Mm-hmm.
some of those families that are in global dorm and have been there for a while, and certainly before school starts, right? We
Yeah.
want to get kids in a home where they feel safe and it's a stable place that they won't feel like they're going to go from place to place. That's one of the most disruptive things in a
Mm-hmm.
child's life is moving from house to house and
Mm-hmm.
community or village to village, right? And they can't establish the relationships with their
Right.
peers and be focused on their schoolwork.
Mm-hmm.
And so we don't want to have
Right.
that going on. So
But
school's
Sarah,
going to
so
start
so
pretty
so
soon.
if the public health emergency is lifted, will global dorms still be open as a homeless shelter?
Okay, my understanding it is we do have a Department of Interior grant that's being vetted right now, and that grant would provide for a permanent emergency shelter facility. So that's being worked on now. And if it's going to mean moving, we're still trying to grapple with the different things. There's a lot of moving parts. We're trying to get people out into permanent housing, which could be Gura housing or other housing. And at the same time, we've got this emergency shelter, permanent emergency shelter that's being overseen at the front office from the Department of Interior. So, with those two things, plus any other alternative strategies we have, we're gonna, I think we should see some great movement. We should see some action in the next couple of weeks. I think it has the work that's been done is building up to us seeing some changes where people are going to be exiting into permanent housing in the next couple of weeks. So let's just, keep the prayers and the good thoughts
Mm-hmm.
going here
Yes.
and the positive energy so that these things get worked out. And all those people that are working with all the bureaucracies, all these challenges, because there are always challenges, that we can get over them so we can get our people into safe permanent housing as soon as
Mm-hmm.
possible.
So is
So
this
good question.
this DOI grant that you're referring to? Is this what's being used to fund this other shelter that you guys are looking at in Tamuning? Because according to Ray, when he was on earlier this week, he was mentioning that there's a possibility of another shelter opening. And he said in the village of Tamuning, and there were some issues with flood insurance or
Mm-hmm.
flood mitigation, something to that
Yeah,
extent.
yeah. So I'm gonna find out a little bit more about that because, like I said, there's just so many moving parts and just different people taking the leadership to get different programs going. So we're constantly, trying to work around all of those things. The DOI funded shelter may be in another place. So how about I see you guys next week? I'll be faithful to giving you updates because
Well,
there's so many things going on, and I
yeah.
want you to know what's happening, and I want our community to know what's going on, and of course, the one thing I would say to everyone that's listening out there is please do everything you can to be patient and loving to your family. And if there are any disputes or, seek help and support so that you stay together. And we don't want to see people feel like they can't stay home or be with their family. Let's find those ways and means, which is really who we are as a people and our keeping our families close. And surely some of them, some people may be quite difficult. So reach out and get help because help is really here. We've got a
Mm-hmm.
lot of great professionals that are geared up to help support our families. And OHAP is here to make sure that the programs and policies are in place and that we advocate for our people to access services. So people are having a problem, you know, let us know that. And, you know, as I said, we're starting to get our office together, and prayerfully, we're going to even have a landline. But in the meantime, they can leave a message at the governor's office or even at Global Dorms, and I will certainly get back to them if they see that things are not happening in the way that they think it should. But let's do this together, people. We've gone through worse things, and this is just one of those challenges to show the resiliency and the strength of our people. So love your family, try to keep them home and intact and access them to services. That would really be a key. Yeah. Thank you.
And you know what, everybody, please send some prayers up for Sarah and her team, because they've got just a monumental problem trying to solve ahead. And what she's very articulated very, very well here today is just how complex it is to deal with so many people who don't have permanent housing in a variety of situations and everything like that. So Sarah, you know, like our thoughts and our prayers continue to be with you, you know, as you continue this good work that you're doing. So thank you for your time.
Stay well, you guys.
All right, we'll talk to you before Liberation Day for sure.
Thanks,
okay,
Sarah.
I'm here for you.
All right, just have a good
care.
day. All right, Sarah Thomas Nededog. You know, it's also worth pointing out, Bree, that I like those words that she had in the end about, you know, like, you know, if you're experiencing some, you know, rough time within your family, you know, do what you can to like stay together. And that's actually drawing on her experience as executive director of Sanctuary from many, many years ago. And, you know, just seeing inner turmoil within a home and people just saying, oh, well, I'm going to walk, you know, or get out, or I'm going to leave and everything. You know, so many different, you know, types of situations, everything. Well, she's very well versed when it comes to that, but she's just saying, stay together. And I mean, it's so heartbreaking, and you and I have seen this when we've gone out and done stories, especially when people without a home have children, and, you know, just whether they're, you know, asking for donations on the side of the road or in the median, and you just see like a little kid or a teenager with them. They may be sitting there, you know, underneath an umbrella or a tree trying to get out of the shade, you know, like munching on a candy bar or something, because that's all they have. I mean, it's so unbelievably heartbreaking.
Yeah, she's always been in the trenches helping people who are less fortunate and helping people who are in trouble. And so
she cares.
So, yeah.
And she's a grinder.
Yes, she is. Oh, speaking of grinders, you know what? We do need to do sports.
Yeah.
So let's go to Dave Delgado.